Multiple Sclerosis and Guillain-Barre Syndrome by Patrick Barney, Kendall Benassi, Erandy Gonzalez, Taylor Hoffman, Wendy Lillystone, Mallory Pohlman, and Doron Roth.
Risk factors for Guillain-Barre syndrome include a preceding respiratory or gastrointestinal, viral or bacterial infection, previously having Guillain-Barre syndrome, having surgery, or a recent vaccination. Risk factors for multiple sclerosis include having a Northern European ancestry, having a first-degree relative that has multiple sclerosis, being a female, and having the human leukocyte antigen HLA-DR2 haplotype. Manifestations of Guillain-Barre syndrome include symmetric muscle weakness that starts in the lower extremities, paralysis of intercostal muscles, altered chewing, swallowing, and speaking, fluctuating blood pressure, tachycardia and cardiac dysrhythmias, and urinary retention. Manifestations of multiple sclerosis include visual deficits such as blurred vision, fogginess, and impaired color perception, brainstem lesions that present as nystagmus, vertigo, vomiting, and eye pain, mood alterations that present as depression usually, weakness and or numbness in one or both extremities, most commonly in the legs, upper motor neuron involvement that presents as stiffness, slowness, and weakness, bladder dysfunctions that include incontinence and urgency, bowel dysfunctions including constipation and sexual dysfunction.
So complications for MS would be optic nerve degeneration, hemiparesis, quadriparesis, and paraparesis. The patient could also have dysphagia, which could increase the risk of aspiration pneumonia. The urinary sphincter dysfunction could also increase the risk for a UTI or kidney infections. And now moving on to complications for GBS. Those complications could be complete paralysis of the intercostal and diaphragmatic muscles. So with assistance, that would require assistance in mechanical ventilation due to respiratory dysfunction. These patients would require ventilatory assistance and supportive care, and involvement of the autonomic nervous system is characterized by fluctuating blood pressure, cardiac dysrhythmias, and tachycardia, and this could also lead to paralytic ileus and urinary retention and difficulty with mobility.
This slide shows the medical treatment of both MS and Guillain-Barre syndrome. So, beginning with the medications for MS, these are used to slow the progression of the disease and decrease the number of acute attacks. Immunomodulators such as interferon beta-1A and beta-1B are used for patients with relapsing remitting MS to prolong the time of onset to disability. Adrenocorticosteroids include ACTH, prednisone, and methylprednisolone, and these are used to sustain remission or to treat acute exacerbations. Baclofen, dantrolene, and diazepam are examples of muscle relaxants used for MS, and these relieve the muscle spasms associated with it. And last, immunosuppressants such as cyclophosphamide and others are given to treat the autoimmune component of MS. Nutrition and fluids are also important considerations for the patient with MS, and those include weight control, which is due to the depression and immobility that can happen. These conditions put the patient with MS at risk for being overweight, so monitoring their dietary intake and BMI are important. Patients also may experience dysphagia due to poor muscle tone, weakness, and ataxia, so the use of soft foods may be utilized to avoid complications. Moving on to Guillain-Barre syndrome, There are no medication guidelines that are set for the treatment of Guillain-Barre syndrome. However, there are medications that may be used to treat the effects of the condition. For example, antibiotics may be used to treat resulting UTIs or respiratory infections. Morphine can be used for pain control, anticoagulants to prevent thromboembolic complications, and hypotension may also occur as a result of GBS, which is treated with vasopressors. On the next bullet, you'll see plasmapheresis, which is the exchange of plasma, and this can be used 5 times over an 8 to 10 day period, and it usually happens within the first 2 weeks of development of Guillain-Barre syndrome. So what happens is they take antibodies from the patient's plasma and they concurrently administer immunosuppressive agents. Nutritional considerations for Guillain-Barre are to maintain positive nitrogen balance, ensure sufficient fluid and electrolyte intake, and to maintain adequate caloric intake. Much like MS, GBS can result in dysphagia, so TPN or feedings via gastrostomy or NG tube may be indicated for those with the trouble swallowing. Whereas the last slide talked about the medical treatments for MS and Guillain-Barre, this slide is going to talk about the interdisciplinary care and complementary therapies for both of the disorders. So, beginning with MS, consultation with the following disciplines are mentioned in the text for treatment of MS. These patients may be seen by a physical therapist who will assist the individual with stretching exercises, gait training, and fitting for braces, splints, or other assistive devices. They may also help the patient with balance, implementing walkers, canes, or other assistive devices that they need for ataxia. In addition, speech therapy may be used for those who experience problems with phonation or swallowing due to the disease. Occupational therapy will assist patients to maintain maximum strength in the upper extremities and carry out ADLs. Respiratory therapy may be consulted if the patient suffers from chronic respiratory infections, and respiratory therapy will help the patient to promote the ability to cough, to move secretions, and to breathe deeply. Last on the list is urology, and referral to a urologist is warranted for patients with MS who suffer from urinary incontinence, UTIs, urinary retention, or impotence. Some complementary therapies mentioned as possible adjunctive therapy for MS are chiropractic therapy, marijuana or cannabis use, massage, and acupuncture. The National Multiple Sclerosis Society states that some patients may find these therapies effective for symptom relief or management, but that medical treatment adherence is of utmost importance even when trying CAM therapies. So that's important to educate your patients on. Just let them know that these may be a good option, but that sticking to the prescribed method of treatment is also very important. Realignment strategies used in chiropractic therapy has the goal of eliminating irritation to the nerves and restoring normal function in patients with MS. The use of cannabis controls distressing symptoms associated with the disease, which can be pain, tremors, and spasticity. And last, using massage, pain caused by MS may be relieved, along with relief of spasticity, restoring circulation, and preventing pressure sores. Those who suffer from edema, osteoporosis, ulcers, or enlargement of the liver or spleen, as well as recent injuries in pregnant women, are advised not to use massage therapy. Okay, so moving on to Guillain-Barre syndrome. A patient who has Guillain-Barre syndrome may be seen by physical and occupational therapy for prolonged periods of time, but these may be delayed due to respiratory dysfunction, which may be associated or due to Guillain-Barre syndrome. Beginning during the acute phase, therapists help patients prevent complications and limit the effects of immobility due to severe muscle atrophy. Atrophy may also require that patients relearn basic functions and skills, such as walking. Complementary therapies that are seen in the Limon text say that they're used to control pain and manage anxiety associated with Guillain-Barre, and those are the application of heat and cold, guided imagery, relaxation techniques, and massage.
The diagnosis and manifestation of multiple sclerosis, understandably, can have debilitating consequences to psychosocial well-being. Symptoms of blindness, fatigue, and impaired mobility interfere with a person's ability to perform daily functions. Cognitive effects alter a person's ability to concentrate and plan activities. Memory impairment can also be evident. Multiple sclerosis can also have direct mood-altering effects, resulting mostly in depression. Our mental health book describes this as a depressive disorder due to a mental condition. The impairment of daily function can be isolating, as getting out of bed to brush teeth or comb hair is now a daily struggle during episodes. Although depression can be a physiological response to the condition, it can also occur with the realization of the diagnosis and enduring its gradual loss of function. Depression can cause decreased libido, which, coupled with sexual dysfunction experienced with multiple sclerosis, can put strain on relationships. A patient can understandably feel hopeless after being diagnosed with a disease that is not fully understood with no known cure. Treatments for multiple sclerosis have psychosocial implications as well. Immunomodulators, such as interferon, can cause depression and thoughts of suicide. Long-term steroid therapy causes immunosuppression, which can deter patients from being in large crowds due to risk of infection. Behavioral modifications can also be seen with steroid therapy. Finally, muscle relaxants, such as Valium, can have a sedative effect, and as most of us have possibly seen in our clinical experience, can cause patients to have a flat affect, making interpersonal relations difficult. The diagnosis and manifestations of Guillain-Barre syndrome can also have a detrimental impact on patients' psychosocial well-being. With acute episodes, a patient can be bed confined for 2 to 3 weeks. Episodes can consist of full paralysis with respiratory failure. Oftentimes, patients aren't diagnosed until being hospitalized in this fashion. Understandably, a patient can feel fear, anxiety, and helplessness. Full recovery can be achieved, but only after 2 years of rehabilitation, which can cause anger and frustration if results are not seen rapidly. Inability to perform daily functions, similar to what is seen in multiple sclerosis, can also be frustrating and may make patients susceptible to feelings of depression. Lifelong fatigue, abnormal sensations, and muscle weakness can impair desire for normal social function. Other complications that go beyond the acute phase include post-traumatic stress disorder. Enduring a relatively rapid onset of paralysis and inability to breathe can be terrifying. An article published in the Journal of the Peripheral Nervous System found high incidence of PTSD in Guillain-Barre syndrome patients following an acute episode that required mechanical ventilation. Therefore, it is evident that Guillain-Barre syndrome can have immediate and long-term impacts on a patient's psychosocial well-being.
Community resources for multiple sclerosis and Guillain-Barre syndrome. For multiple sclerosis, the National Multiple Sclerosis Society. They have chapters located in Ohio Valley and College Hill. The chapters of the NMSS work to improve the quality of life for people affected by MS in southern Ohio and northern Kentucky, along with raising money for multiple sclerosis research. They currently have 2 bicycle rides to raise money for MS research. One is located in Dayton, and the other one is in Oxford. These community centers have discussion groups that are offered both online as well as in local communities by zip code. These centers also offer financial assistance, health and wellness groups, appointments, employment, social and emotional support, and family support for family members affected by someone with MS. For Guillain-Barre syndrome, the GBS-CIDP Foundation, their closest chapter, is located in Auburn and Columbus, Ohio. They do offer support groups online, which include help finding doctors, connections to support groups, both online and local, if available, access to patient stories, answers to the questions such as what is GBS, how to treat it, and how to live with GBS. Access to GBS online forums. The only local community resources for GBS are located inside Cincinnati hospitals when the patients meet with their physicians.
Sclerosis, also known as MS, is a neurological autoimmune disorder which affects nerve cells in the brain and spinal cord, resulting in impaired and worsening function of voluntary muscles. It is characterized by the development of plaque in the white matter of the CNS, which damages the myelin sheath and interferes with impulse transmission between the CNS and the body. The disorder is progressive and symptoms vary amongst clients. Nonetheless, some common findings include those involved with cognition, functional ability, nutrition, senses and perception, oxygenation, perfusion, and mobility. Symptoms concerning cognition are forgetfulness, impaired judgment, scanning speech, emotional ability, irritability, and apathy. Those surrounding functional ability are intention tremors, fatigue interferes with the activities of daily living, limb weakness, and muscular atrophy. Symptoms involving nutrition can include being overweight due to the inability to move. Depression can cause people to eat more, and the ability to prepare food is impaired, as well as dysphagia or difficulty swallowing. In terms of the senses and perceptions, people with MS often experience blurred vision, diplopia, nystagmus, eye pain, visual field defects, vertigo, paresthesias, pain with spasms, loss of proprioception, numbness, diminished senses of temperature. Those with MS feel fatigued and have trouble swallowing, which can affect their airway clearance. Their diminished cough reflex interrupts oxygenation by leaving mucus behind. For some experiencing poor oxygenation, possibly coupled with respiratory infections, impaired perfusion can result from increased amounts of thick mucus in the respiratory tract that is left due to a diminished cough reflex. Common symptoms affecting mobility of a person with MS can include ataxia, dragging of the foot, spasticity, vertigo, and numbness and weakness of the extremities.
Guillain-Barre syndrome is characterized by progressive ascending flaccid paralysis. The loss of muscle strength is severe and rapid, causing weakness in both the lower and upper extremities. Cognition and level of consciousness are not affected in Guillain-Barre syndrome. Once facial nerves are affected, there will be an inability to change facial expressions or close the eyes. Additionally, the muscles involved with chewing, swallowing, and speaking can be affected. Nutritional support is crucial for the patient with Guillain-Barre syndrome. Some goals of nutrition therapy include maintaining positive nitrogen balance, ensuring sufficient fluid intake and electrolyte balance, and ensuring the patient is receiving his or her recommended caloric intake. Total parenteral nutrition may be necessary if swallowing is impaired and feedings by a nasogastric or gastrostomy tube is ineffective. Sensory loss begins in the lower extremities and then ascends to the upper extremities, torso, and cranial nerves, causing severe pain, paresthesia, and numbness. About 20% of patients have respiratory involvement to the point that ventilatory assistance is required. Ventilatory assistance becomes necessary when paralysis of intercostal and diaphragmatic muscles alters respiratory function. Some ways in which Guillain-Barre syndrome could end up affecting perfusion. is that onset of disease can occur 1 to 3 weeks after contraction of bacterial or viral respiratory infection, which would affect the perfusion if your oxygenation is low. Muscle weakness and atrophy lead to decreased mobility and, therefore, less perfusion to the body's tissues and organs.